Then we're going to take action, or actually implement the action that we know the patient needs. So here we've got diagnostic results for a patient who became unresponsive and has no palpable pulse. They've got gasping respirations. So we look at our diagnostic results here, and we've got this EKG tracing. So what is y'all's interpretation of this rhythm? I'm going to let y'all kind of trickle in your answers for that, but we're being asked, which of the following actions should the nurse take? Should we initiate chest compressions, give IV push atropine, obtain a 12-lead electrocardiogram, or deliver rescue breaths? All right, Marky says PEA. All right, start CPR. So most of you want to start CPR, and I am glad. I would definitely want you as my nurse if you would start chest compressions for this, because there's really only one piece of information in this question that you need to answer it, and it's actually right here, no palpable pulse. So it does not matter what your monitor shows. If your patient doesn't have a pulse, that means this is a pulseless rhythm, whether it's PEA, pulseless electrical activity, or VFib or VTAC. You can have all the electricity you want, but if it's not actually generating a cardiac contraction and a pulse, this patient needs CPR. And it's important to do this quickly because that's going to pump blood and restore blood flow while we're trying to give epinephrine, shock them, or do whatever else to correct the underlying cause, which in this case would be your H's and T's, right? So yes, we are going to initiate chest compressions ASAP, because every second we delay it, their brain tissue is dying, right? So very good. I'm glad you guys got this one right. But why would we fall for some of the others? Because you're right, it is tricky. This is a tricky situation to be in. So giving atropine, that would be appropriate for bradycardia with a pulse, right? If this patient was kind of symptomatic, dizzy, had chest pain, and then they're talking to us and we put them on the monitor and we see this, that would mean we would need to treat this as symptomatic bradycardia, and giving atropine or pacing, actually putting them on a pacer, will correct that and get the heart rate up. But this is not that problem. This is pulseless, right? So this is incorrect. Then getting a 12-lead EKG. Again, we already have all the information we need. It doesn't matter what the EKG shows. We know that they don't have a pulse, and that's all we need to know. Assessing first is not always the right thing to do on the NCLEX. That might have worked with the old NCLEX, but you guys have been told, oh, on priority action questions, always assess first. Sometimes you have all the information you already need. And in this case, we do. So this would just delay care. Then delivering rescue breaths. If they had gasping respirations and a pulse, then we would probably give rescue breaths, right? We would maybe, in the case of an opioid overdose, just use the bag valve mask, give some Narcan, but again, this patient doesn't have a pulse, so CPR is our priority. Very good.